I am Nancy Onyebuchi, and you are welcome on board to the program Delta Health Insurance and You, here on Delta Rainbow Television, DRTV Worry. Now the program brings you information and activities of the Delta State Contributory Health Commission and teaches you that your health should always come before anything else. Now, before we will proceed, we'll go on a short break, and when we come back, we will talk more. Don't go away.
My husband, no be Tessa be that.
Yes.
Shebi she talk say no money to pay hospital bills. Abi, she no wan pay the money when she dey home me since. Make I go meet her. Tessa, my friend, I dey happy say your pikin don well and you don discharge am from hospital. Tessa, you no wan pay me my money.
Thanks for your patience. I go pay you your money tomorrow morning. Talking about my pikin medical bills, I no pay 1 naira.
See as I wish say, na so e still be for adults.
Madam, that one na be equity plan.
Free medical services available for all residents of Delta who enroll under the Delta State Contributory Health Insurance Scheme.
And not just once, you go pay very small money and you go get free treatment for the whole year. We dey call this one informal plan.
To prevent the burden of having to pay at the point of receiving healthcare services, especially in situations of limited funds, I think I like this informal plan.
Women, when register for equity plan under Delta State Health Insurance Scheme, when born through CS or vaginal delivery, now free medical services.
In fact, Market Men and Women Association, they enroll under the informal plan with small money and get free treatment for the whole year.
Na I be say, as I don't get belle so, na to go register with the Delta State Health Insurance.
As you don't get waiting, join the 7.
Expanding health insurance coverage in Delta State.
You're welcome back from that short break. If you are just joining us, it's the program Delta Health Insurance and You, here on Delta Rainbow Television, DRTV Worry. Now, on today's edition, we are looking at the INDIGENT ENROLLEE Adoption Initiative and how 200 persons from 2 different communities have successfully gotten enrolled into the Delta State Health Insurance Scheme. Now, the sponsors of the event are both members of the Delta State Contributory Health Commission, and they have decided to bring the good tidings of the commission. And when I say good tidings, I mean quality and affordable health care for a period of 1 year to indigent persons in their locality. Take a look. The Delta State Contributory Health Commission has continued to intensify efforts to achieve universal health coverage for all Deltans. This was further demonstrated when some indigents of Eruemukohwarien and Emevor communities in Ughelli North and Isoko South local government areas were enrolled into the State Health Insurance Scheme under the INDIGENT ENROLLEE Adoption Initiative. 100 enrolled indigents from each community will enjoy free medical access for 1 year, sponsored by Deacon Sunday Agogo Omamogo and Comrade Glory Ikinimore. At the Eruemukohwarien community in Ughelli North local government area, the indigents gather at the community town hall for enrollment into the Delta State Health Insurance Scheme. 100 indigents of the community were selected and sponsored by Deacon Sunday Agogo Omamogo, an illustrious son of the community. Deacon Sunday Omamogo, a member of the board of the Delta State Contributory Health Commission, lauded the Director General of the Commission, Dr. Isaac Akuveta, for his leadership strides and concerns for the healthcare of Deltans.
We are happy, and they said I should return greetings to you, and that came that we led when we take off and we carry it back, and that the program will bring that successful. I want to assure you that we cooperate and we do everything possible to make this program successful.
He commended the Delta State Governor, Right Honorable Sheriff Obewuri, for creating an enabling environment for the Commission to realize its objectives.
When I come and I see them, in things, complain of lack of money to pay more hospital bill, and I see them resorting to native treatment in most cases, which have led to the death of so many persons in this community. That is why I feel that we are still to help them. Reason behind this sponsorship. It's a good program because it has helped to reduce mortality rates in so many communities. You know, you think that 7,000 naira is small, but so many people in this country are living below the poverty line. And when you give them this policy, it's like a lifeline. You know, there was a lady who was telling me in Asaba that, you know, that I can go to certain hospital to receive treatment like a governor. There's a kind of joy that they have the opportunity of attending a clinic or any hospital of their choice. Just with this payment of 7,000 naira indigent a year. It's a valuable project. I want to encourage anybody who is in position who has the capacity to see how he can help his people. And not only his people, even neighbors in Asaba before now, I'm paying for 2 persons. One is my driver's wife, another one my neighbor. So you don't need to be a rich man before you can do it. With 7,000 naira you can do it. I paid for my elder sister before in the village. So if it's just a small thing, a token amount, you save your life.
At Emevor in Isoko South local government area, another 100 indigents of the community were enrolled into the state health insurance scheme, sponsored by another board member of the commission and an indigent of the community, Comrade Glory Eruemukohwarien.
Indeed, highly honored to have the commission come to Emevor. And I'm sure that all our people in Emevor here seated are very happy to have all of you come here to enroll us into the Indigent Enrollee program of Delta State Governor that is helping people to live healthy lives, especially for the very vulnerable group who cannot actually take care of themselves. So we are very happy that you have come here to do this for us. And I'm sure our people here, you can see they have smiling faces because they know that you have come to better our lives in the Emevor Kingdom. And so on behalf of the entire Emevor Kingdom, on behalf of all of us that are seated here welcoming you, we want to say thank you for coming, sir. Emevor is a very peaceful and very quiet community, and I'm sure before you leave this hall, you will know that for yourself.
Comrade Eruemukohwarien expressed concerns for the health needs of indigents of his community, calling on others to key into the initiative.
I want to first appreciate the Delta State Governor, Eruemukohwarien. First, he gave me the opportunity of becoming a board member in Delta State Contributing Health Commission, and as his mandate is of making sure that all Deltans are healthy, we as members of the board decided that at least let's register people to enjoy these free health services as far as insurance is concerned. So I had to do it for my people in my community, Emevor. And today is a dream come true, and the state has come here to register my people. So I'm happy, I'm very happy. It's a dream come true. Like I said before, that I'm using this opportunity to also call out to other persons who are well-to-do, who are also occupying positions where they are comfortable. They should also be able to reach out to these less privileged persons who are within their domain, you know, to do something that will affect their lives positively by registering them into this affordable health program that the Delta State government have put in place, so that when they are healthy, at least they will be able to go out and fend for themselves. You know, most especially in these difficult times we are in this this country we are in, Nigeria. You know, so I suggest and I really plead with all of them, wherever they are, those in diaspora, let them come out and help their people so that Delta State becomes a healthy state as far as we are concerned.
The Director General of the Commission, Dr. Isaac Akpoveta, commended the philanthropy of the sponsors, urging others to emulate it by helping others in their locality to get free access to healthcare services.
I'm immensely delighted to be here today because it was so that by the rich also by the poor. And the poor doesn't have money to treat it, the mosquito will spread more and more. Therefore, every human, every personality that has money in the society must help the next level. You don't need to have plenty of money. The rate is just 7,000 naira. With 7,000 naira, you buy a health card for your neighbor for 1 year. Nothing can be as cheap as that. And yet, nothing can be as mighty as that. Because health is wealth. It is heartwarming to see a spirit of solidarity and community support exemplified by INITIAVE. For those who need it most, this gesture is a great favor. It's a lifesaver. And I appeal to all elders of means to please emulate our brother, Mr. Comrade Emevor. And I also want to announce that my member also, Sunday, and today, also got 100 for his people in Eruemukohwarien. This part of him. These gentlemen of good spirit need to be emulated, and I call upon all the elders, both home and abroad, Nigerians and the diaspora, to please emulate these people, purchase insurance for your neighbor, and ensure that everyone is carried along in Delta State. More must be given for more people as agenda of the governor of the state, Right Honorable Eruemukohwarien.
Beneficiaries of the Indigent Enrollee Adoption Initiative commended the Delta State Governor, the Commission, and the sponsors for the healthcare support for 1 year.
We have the opportunity to take this car to go any hospital, in several hospitals to take for my healthcare. I thank God for my life. I thank God for my brother who gave this opportunity to pay for us for this 7,000 for the card. I should thank Honorable for Commissioner for the head, Isaac Akpoveta. I should thank God today for all the workers that come to take this opportunity for us. We thank God for our community. Before, now management attack when we even get the money self, not to take the buy something to come we want to go to take it, and not to take the buy people there. At times we will buy chemist. At times not the right drug that will do to us. Then we thank God I'm going to this at hospital. I will take better drug to treat myself. I think that's the unity. Somebody got people sick. And so I thank him. After I thank him, may God bless her. May God bless her. Give her long life. And we can see everything right.
I appreciate it greatly. And I thank them so much too.
First, I have to thank God for His mercy for making me a part of one of them. And I have to thank God for the government and those that He used, especially our bros who helped us. In fact, I've been in the government and in fact, I don't know how to say it here, I don't know how to put it, that there have not been something like this. Though for the time they did for pregnant women then, but not general like this. And so now it's helping the less privileged and some of us. What I have to say that first of all, I have to appreciate God to bless him more, to give him more wisdom. He has tried, in fact he tried. These are the kind of leaders we are paying for, who will care for the people, not to collect, but to say what can I do for my people, just like what he has done now, to help people. I'm feeling very, very grateful, very grateful, very grateful, because this is what we not expect before. Suddenly they call me this morning, my brother, call me, say our pikin, Glory. So you want to come and do something back here for us. say I should come. I said, well, I did bush before, I go time. He said, no, make I come by 2 o'clock. So when the time, make the time say I don't reach 1 o'clock. I just rush come for time. Reaching here, when they're disturbing all these things is, see, if they say you see some at the left, I was very, very grateful, very, very grateful. I'm happy for me to see this opportunity to go hospital. Anytime I need to go hospital. Oh God, very, very happy. Then the secondly, I was very glad to see that we have one big brother like this. In fact, I've been very happy.
Health Ambassadorship Award plaque was presented to the sponsors for a job well done.
Major award presented to Mr. Sunday Emevor as Health Insurance Ambassador in recognition of your exceptional commitment to improving healthcare access for vulnerable members of our communities in Delta State. On 4th September 2024, on behalf of the government of Delta State, on behalf of the Delta Health Insurance Commission, I hereby present you this plaque of honor. The special award presented to Comrade Glory Eruemukohwarien as a Emevor ambassador in recognition of your exceptional commitment to improving healthcare access for the vulnerable members of our communities in Delta State. I hereby award.
Beneficiaries of the initiatives were given instant health insurance cards to take care of their health needs.
My husband, no be Tesse be that.
Yes.
Shebi she talk say no money to pay hospital bills. Abi, she no wan pay the money when she dey home since. Make I go meet her. Tesse, my friend, I dey happy say your pikin don well and you don discharge am from hospital. Tesse, you no wan pay me my money.
Thanks for your patience. I go pay you your money tomorrow morning. Talking about my pikin medical bills, I no pay 1 naira.
See as I wish say, na so e still be for adults.
Madam, that one na be equity plan.
Free medical services available for all residents of Delta who enroll under the Delta State Contributory Health Insurance Scheme.
And not just once you go pay very small money and you go get free treatment for the whole year. We dey call this one informal plan.
To prevent the burden of having to pay at the point of receiving healthcare services, especially in situations of limited funds, I think I like this informal plan.
Women wey register for equity plan under Delta State Health Insurance Scheme when born through CS or vaginal delivery na free medical services.
In fact, Market Men and Women Association they enroll under the informal plan with small money and get free treatment for the whole year.
Na I be say as I don get belle so na to go register with the Delta State Health Insurance.
As you don't get wetin, join the 7.
Expanding health insurance coverage in Delta State.
And with that, we come to the end of the program, Delta Health Insurance and You, here on Delta Rainbow Television, and I hope you had a wonderful time. We are urging you to join us same time, same station for another health edifying edition of the program. I am Nancy Onyebuchi, and remember to stay safe and get your health insured. Bye for now.